bad like me.
Yeah, this is the Heat Man and Patio. Hitting it at 88.5. You don't know.
This is not a laughing matter.
Me no afraid of no bullbuck, no dopey conquer. Me no fire one shot.
I always listen to 88.5 Super FM. I love it.
I'm always locked on to 88.5 Super FM. It's hot. 88.5 Super FM. I'm always locked on, and so should you.
88.5.
88.5 are number one. Mud.
Casualty 911, 10 a.m. to 11 a.m. with the consultant. Health is not merely the absence of diseases. It is your social, economic, physical, spiritual, and mental well-being. Just imagine you on 88.5 Super FM, talking, questioning, sharing your experience, information, education, entertainment, news, instructions, advice on diabetes, high blood pressure, strokes, menopause, AIDS, pregnancy, sex.
Sex? Did you say sex?
As prescribed, take your medication, exercise, and diet. On 88.5 Super FM, tell a friend, call your neighbor. Casualty 911 is on.
It's now 10 minutes after 10 a.m. in St. Lucia and the rest of the Eastern Caribbean. It's the 16th day of September 2024. Hope you're having a wonderful day wherever you are. And if it's 10 a.m., between 10 and 11 a.m., it's Casualty 911. And in studio, we have with you your host for today, Miss Louisa. Miss Louisa. I'm trying to get the last name. But Miss Louisa is here with us. Good morning to you, Miss.
Morning, Romanas. I told you that most probably you will not remember my name.
Well, I have the first name saved, so that's how I was able to remember the first name. So, but you can remind me, Miss Louisa.
So my name is Louisa Wilson. Many people know me by Face. Some people know me by Miss Wilson. Some people know me by Louisa, but which is a very, very good thing. Like I was telling Rome, Roman, as you know, the thing about it is everybody remembers the face, the voice, and sometimes they forget the name.
Mm-hmm.
So it's always a pleasure to be back on Casualty 911. It's such a long time we have not been on in studio. I'm sure many of our listeners have missed us. Likewise, we have missed you out there, and to provide all the necessary information your health topics. Today we're going to have a beautiful topic, and it's all about you today. But for now, I just want to speak about childhood cancer and the initiative that the ministry is having. As you well know, tomorrow we're observing Childhood Cancer Day, and we would like everybody, the ministry would like everybody to wear the yellow gold as a means of, creating awareness. And it's an initiative, a Go Gold initiative. So tomorrow, our school children, we're advising our community members, if you're coming out in town or you're just at home, wear yellow or gold. And the theme for childhood cancer awareness is reducing the survival gap. And one of the things that we realize is childhood cancer is not something that shows signs and that you can really pick up very easily. Sometimes it takes time, and sometimes your children complain about a particular thing, and then you think it's one thing, you misdiagnose, and by the time in a few years or months' time, then they tell you it's most probably cancer. So it's something that we as parents have to be vigilant. We have to make sure that when our children come and they tell us something is happening to them, take them to seek medical attention, because we sometimes we as parents tend to be negligent. Oh, you just have a fever, let me give you some paracetamol or this or that. And then we don't really take our children to seek medical attention. But sometimes these are the small signs that really comes out, years of repeated complaints from our children and so on. For persons who have had children with a child with childhood cancer, um, they know what it's like, because I mean, as a parent, to see your child suffering, it's not an easy thing. And the cost attached to treating a child with childhood cancer is quite a bit. And we want persons to be aware of all of these things. So tomorrow, Go Gold Initiative, we would like our teachers, our parents, community members to wear gold, and to create awareness, because you don't have many children with cancer, but the very few that has
So
cancer.
how bad is it here in St. Lucia with childhood cancer?
There are not many cases. I think last year we spoke about it. I cannot remember the statistics when I read about it, but it's not something that you have more than 10 cases a year. I don't think so. Um, I had the statistics in a proposal, but I cannot remember.
Okay.
Yeah, but sometimes the thing about it is, when our children are diagnosed with childhood cancer, they have to seek medical attention abroad, which can be very, very costly. A friend of mine just mentioned that a child was recently diagnosed with leukemia. That's one of the cancers that children normally develops. And you could well imagine, yeah, this which one? Yeah, very most common. So these are the things you could well imagine as a mother. You hear these things, and that's not something any parent would like to hear. Having said that, we're going on to our topic, and we have someone who is from the Sufra community, our nurse that has been in the Sufra community for quite a while, providing you with very, very good service. And I will allow her to introduce herself. Let's go ahead.
Okay, good day. I am Shilian Nair Lamontagne Eloise. I am the Public Health Nursing Supervisor for the Soufrière and Choiseul region. So this form one, the area Soufrière Choiseul, they form one region, that is region 6. Okay.
So I'm sure during this presentation, you'll hear me say Nurse Lamontagne and not Nurse Eloise, because many of us might know her as Nurse Lamontagne, or by her house name, or by her first name, because she might have gone to school with you. But normally we call her Nurse Lamontagne, but now she's Nurse Eloise. So excuse me for using Nurse Lamontagne sometimes. So this morning we're here to speak to you about the various services that are being offered within our region of Choiseul and Soufrière. Reason being, one of the things that we realize, the services are there, and many persons do not know of these services, and they come in, they ask questions, and some of them just disregard the service, where the service is provided for you community members. Some of them a small fee attached, some of them free of charge. And what is happening is that if these services are available and you don't have to pay for these services, and you don't make use of these services, eventually these services will be taken away from you. And that's what we want people to be mindful of. We want you to come to our wellness center, ask the questions, ask the nurses the questions about what services that are being offered and how well you can utilize the service. We do not want, when last minute, when everything is going haywire, you expect us to create miracles and to provide the service for you. Now is the time to take advantage of these services. And that is one of the reasons I brought nurse in to speak to you about the services that are currently offered at all our wellness center and Suffolk Hospital Primary Healthcare?
Yes.
Yes. So Suffolk Hospital is primary healthcare and emergency.
Emergency, yes.
So we're talking about the primary healthcare service where you have your health aides like Magella, Fidelia, and Sabina, and so on. So these are the services that they actually offer. So nurse, I will pass on to you. Go right ahead.
Okay, thank you. So I will be giving you information on the clinics and the services that we offer. So in addition to that, I will be giving you the numbers so that you can make appointments and the nurse who is in charge of each of the facilities. So for Suffolk Hospital, that is our biggest facility, the primary healthcare division, and that is manned by Nurse Lauren Eugene. And Miss Wilson has already mentioned the health aides attached. So I'll also be touching briefly on some of the new services that we offer. All right. So on a Monday, this is the schedule for Suffolk Hospital. So I'm going to give the schedule per facility. On a Monday, every Monday, we have child health services. And of course, we do the assessment of the children at various points and vaccination. In addition to that, we have the fifth Monday of the month where we offer gynecological and obstetrician services to the people of St. Lucia, of Soufrière, well, St. Lucia, and that is free. So all of the services that I'm about to mention, they're free. So with that information, we're hoping to have an uptick in the number of persons accessing our facilities. On a Tuesday at Soufrière Hospital, that is antenatal clinic day, and that is for pregnant women. So from the time you find out that you're pregnant, you can access the clinic and all of the services that we offer. The nurse is going to tell you about it. So on the Tuesday as well, every first and third Tuesday of the month, so listen carefully, the first and third Tuesday of the month, we have dermatology clinic. So that is for persons with skin issues. So you can visit it, the clinic that is, and that is free. You know, if you have to go out there, it may cost you 120 to see the dermatologist, but we're offering that service for free. However, you have to call or go walk into the facility to make an appointment. It's because it's by appointment. The second Tuesday of the month, we're offering gynae services again. So this is one of the clinics that is underutilized. And if it's free, I think that person should take advantage of the services. So you are premenopausal, perimenopausal, you've been taking family planning for a long time, you want some counseling as it relates to gynecological issues, you can just make your appointment. Just walk to the hospital and make the appointment, or I will be giving you the numbers at the end of my presentation. Okay?
So nurse, not to cut you short, when you say gynecological clinic, who are we really targeting for these clinics?
For this clinic, we're targeting the women. Okay, so from age 18 and above, we are targeting these women.
Okay.
Okay, so we move on to a Wednesday, which is a very, very, very heavy day. So we have cancer screening, and that is we screen for breast cancer and cervical cancer. Okay, so right now, pap smear in St. Lucia is free. We used to have an older method where we collect a sample from the cervix and we put the sample on a microscopic slide and we would send it to a lab. So right now we are doing a different method, a more advanced method. So we collect the sample from the cervix and we put the sample in a solution, we call it the wet prep service. Okay, so the difference between what was traditional and what we're using now is with the wet prep, the test for HPV. Not that the old method was done testing for HPV, but for this one, it tests for HPV specifically. So you get the type, and you know when you know the type, an HPV, which is the human papilloma virus, it's responsible for cervical cancer. So with that, when we know the type, you know, if we detect the type early, early intervention will be utilized. So the chances of you having cervical cancer, it decreases significantly because early detection is equated to early treatment. And the earlier you detect, the less money you'll have to spend and all of that.
So nurse, do you know the different genotypes that they're actually testing because a friend of mine did an HPV test, and they actually tested her for about 20 something genotypes of HPV. I'm
There are
not sure
quite
how
a
many.
few
Yeah.
types, but what we're searching for specifically is the one that targets cervical cancer, which
So,
is type 16 and 18.
okay.
Yes. Okay. So we have family planning on the Wednesday, postnatal clinic. So 6 weeks after you've delivered, you can visit us at Suffer Hospital for an assessment of yourself and an assessment of the baby. Okay, so at that clinic, you'll be given your date for your vaccines and any assessments thereafter until your baby turns 5, and then we take it from there.
Yes.
Okay, and of course, we also have another gynae clinic on the fourth Wednesday of the month. Wednesdays are very important to us because not only, if you realize, I've mentioned a lot of services for women, but the first and third Wednesday of the month, that is dedicated to men. So we have men's health clinic. And if you visited the clinic, you know it's a thorough clinic where the men are assessed, they're given forms to go and do labs, a physical assessment is done, they're referred for counseling, they receive nutritional advice, all of these services that we offer to the men. So that is a clinic that is underutilized.
Very much so.
It is underutilized.
Rome
So
is
I
laughing.
mentioned that early detection equates early treatment. So why not take advantage of? I know men like to hide, but the earlier you visit us, the better for us. We help you, you help us.
And one of the things I realized, not cutting you short, no, I realized about the men's health clinic is that we don't see the younger generation there, the younger men. We see a few of them come in, and we see a few older men, they come and do their follow ups. But between the ages of 25 to say 40, we do not see that group of men coming to the men's health clinic. And I think I've made numerous attempts, appeal to that group to come in and utilize the men's health clinic. Like you said, it's such a thorough clinic. Like they do all these examination because it's such a small clinic, and one of the things they give the men quite a bit of attention
So,
because
okay,
that's not
so
a group we rarely get.
can you walk us through what men can expect on a visit like that? What does it entail?
Okay, so as soon as you come, you're registered, your vital signs is done, so that is assessed. Then you see the doctor. So the doctor is going to speak to you about the common, and you also have Miss Wilson speaking about the common issues that affect men. In addition to that, they do a physical examination for the men. Okay, and you're given lab tests to do some blood work, just to assess like the men who are over 40, the prostate and all of these things. But you do get a physical assessment where you do the digital rectal examination. I know men.
This one.
Well, this one is very important because it saves lives. A
Yeah.
simple, very quick assessment can save your life. Okay, so there's no reason to be afraid.
Yeah. And the thing about it is, if you really want to come, by the time you go to our CHAs and you
You
tell
will
them
feel relaxed.
you come in for the men's health clinic, they'll put everything in order for you to make sure that doctor gives you a priority because that's the clinic is specifically for that day. So they ensure that you're taken care of, and that's one of the things that they really take pride in doing in that section. So I'm hoping that hearing that most young men, you don't have to be sick, you don't have to feel like you, it's just a normal checkup to know your health status, and that's the best way to go. And in doing that, you can pick up that behavior of doing it every year if everything is okay. Yeah.
So we also have facilities like the Suffer Town Council who ensures that the men visit the clinic at least once for the
Yeah.
year and we follow up with them from that. Okay. Like I mentioned earlier, Wednesday is a heavy day for us. We also have nutritional clinic on that day. So you get to see the nutrition officer who will assist you in developing a diet plan and whatever diet that is necessary for your condition. Okay. On a first day at Sofra Hospital, we have the first day we have STI clinic, that is sexual transmitted infection clinic, where we assess HIV and for HIV and syphilis. And of course, we have moved away from withdrawing of the blood. We do that only if we have cause for concern. So we just prick your finger, we take a little sample, and you get your results within 15 minutes. Okay, so it's just as accurate as if you were to withdraw the blood from the vein. So it's a small finger prick. We've made things easier for you. We also have the second Thursday at Suffolk Hospital, we have psychiatric clinic. So persons, there's no stigma attached to anything that has to do with mental health. And you do not necessarily have to visit somebody when things have gone bad. You can visit just to speak to them. They're very accommodating and they will speak to you on any condition. So what is part of our program is to refer pregnant women, women after they've delivered for counseling. And that is a service that is underutilized just because of the stigma attached. It's very, very important for you to visit the counselor when you're the mental health nurse during this very, very high and critical period in your life. So, I mean, they would have had research that would tell you these, you need to be counseled at these points in your life. Okay. The third Thursday of the month, we have pediatric clinic at Suffolk Hospital. Okay, so this is for children who require more than we can offer at our child health clinic, which is on a Monday. So we see there's an issue, we would refer you to the pediatrician. Some children, like those who are born prematurely, they may need to follow up with the pediatrician because these are cases that are beyond us because we do preventative care and they're in the secondary care where they need treatment or things of that sort. So they have to be seen by a pediatrician instead of being seen by the nurse. All right.
Yeah, and that's a heavy clinic.
It is. It is a heavy clinic. So we used to have like 2 clinics for the month at Suffolk Hospital. We currently have 4 clinics, pediatric clinics at Suffolk Hospital. Okay. So on a Friday is a heavy day for us as well. We have diabetic and hypertensive clinic every Friday of the month. Okay. So the first Friday we have pediatric clinic again. We have podiatry clinic, and that is for our anybody with any issues below the ankle. So the podiatrist is not going to see you if you have an issue on your kneecap or whatever, but anything below the ankle, she's going to assess. Every diabetic, we recommend that they visit and utilize that clinic. It's another underutilized clinic. So for the diabetics, you'll be taught how to take care of the foot, what to do, what not to do, the types of shoes that you should be wearing, and they clean up your feet so nicely. Yes, so you don't even need to go to.
And that's not a place for pedicure for women. There's some people come and they come as if there's a pedicure they want.
Yes.
If you want a medical pedicure, you go to somebody that specializes in this. The podiatrist is there to assist persons that really need that kind of, service. I know I've heard other young ladies come and they say they come and clean their feet. No, that's not a clinic for you. You go to the salon Pleasantons.
Yes. So we have, in addition to that, we have the internist clinic. So you visit the internist when you have visited your doctor and, medication isn't working, diets and exercise, there's no improvement in your condition. So you have to see the internist. Again, all the services that I have mentioned, free of charge.
Free of charge.
Yes. So just imagine that. Preventative care and you'll be fine. All of these
but
services free of charge.
I see a heavy emphasis being placed on early childhood and diabetes. So is that something that is a problem here in Soufrière or in St. Lucia, where we have a lot of children now with special needs and we have a lot of a higher case of diabetes?
We have a higher case of diabetes for sure, and we see more. The thing is, we have our requirements, and as long as they don't fit into these requirements, we refer them. So one, send persons, refer persons to the clinics for just for reassurance sometimes. So it might not
Yeah.
necessarily mean that your child is not
No, what I'm saying,
normal
you have 4 days
for the
in the
pediatric
month,
clinic.
yeah,
Yes.
and you have every Friday for diabetes. So you're really focusing on these two. So which means that there might be a problem. There's
Yes.
something that you've seen that needs to be highlighted, that you have to really place more energy in that aspect.
Well, every facility they have a day per week for all of the diabetics and hypertensives. So it's not placing an emphasis really, but just
But
giving
but
persons the opportunity.
but we have a problem with diabetes. That's what
We
I'm
do
asking.
have a problem with diabetes. I said that earlier. We do have a problem with diabetes. So it's diabetic and hypertensive clinic.
And
And persons come in just to check their pressure and their sugars that day.
okay.
Yeah, so it is the day that is assigned for that service.
And now I hear a lot more children are being diagnosed with autism as well. So that would probably be the reason for, the increase in the pediatric care.
Yes, also it's for students who are slower than others. So it's for a whole
It's a
lot
level
of
of
them. Yes.
autism.
But
No?
different medical conditions that we are seeing now. Okay, and like I said, just for reassurance, you did not, before we would assess a child many times they before we say, okay, let's move on. But now we can only assess a child twice before we refer to the pediatrician. So your child may be shy and withdrawn. They come the first time, they come the second time, but we don't know that your child can do the activity, so we have to refer the child. Okay, so sometimes you may be a little upset that we think that your child is slow, but really your child is just very shy and withdrawn and slow to warm up. So we refer that child just to be on the safe side. Early detection again. We don't know that. Okay.
So, just to add to what Rome was asking, yes, some emphasis is being placed on diabetic and hypertensive clinic because what you find is that we have a lot of cases of diabetics and persons that are actually hypertensive, and but the other specialized clinic you can only provide these services because these specialists, some of them are utilized island wide. So you cannot have them stationed at our
Oh,
facilities. And they also go to our other wellness centers also, like the podiatrist. She does all our wellness centers. So she had to be give days for a schedule for the different wellness centers and even our internists. They are utilized at other wellness centers. So even if there is the issue there, but however, persons that are specialized, our doctors that are specialized, they don't only service our region; they service other regions as well. So
okay. I
that is
understand
why
now.
you cannot
Have them more,
more
just as much
often.
as the,
So
okay.
that is why we're saying that some of our clinics we're offering you these services, but yet still they are underutilized. Yeah.
Okay. So another new service we have is the lab services. Um, they come to Children's Hospital. They come to Super Hospital every Friday, and that is to withdraw bloods for our clients. So our diabetic clients, our hypertensive clients, if we want to confirm cases, that is under the full
Performance based
performance-based
finance.
finance project. Okay. So we assess your cholesterol levels, we assess your kidney and liver function, your urine, we assess your blood sugar to see what it has been in the past 3 months, if whatever regime that you're on, if it's working, if it's not working. So that is something that is, well, fairly new. It has been there for over a year. The newest service that we offer is the metabolic screening under the metabolic surveillance
Yeah.
diseases.
So that's for children.
So it's for with the performance-based financing. We start to screen persons from 18 years and above, but with the metabolic, we start at 15. So we'll be going to the schools soon to start screening the students for high blood pressure, high blood sugar. We'll be going further. We'll be testing the cholesterol levels because we've noticed that high blood pressure and sugar is very high amongst our young children.
Yeah.
What do you think would be the reason for that? Is it because of what we intake, the
Yes, it's our
drinks
poor
and
dietary.
yeah, because people don't
Yes.
cook anymore. People just have fast food.
It's not that people don't cook anymore,
Well,
but
It's
also
our
our children are
choices.
less active too.
oh,
Physical
And
okay.
then
activities.
we eat more, our children eat more packaged food, processed foods, and so on. And some of children are addicted to sugar. Yeah, if they don't have any sweet thing for the day, you see their reaction. They get hyper and so on. It's almost like an addiction.
Okay.
Yeah. And some of our children don't eat fruits at all. They don't even know the different types of fruits. They have never tasted it because parents don't offer these children fruits and vegetables at a very early age. Yeah.
So that's why we need some level of education to educate the parents, especially as the right practices.
Yes,
We
so we
have
have
been doing
Miss
that.
Wilson going around to all work, workplaces, all the schools to inform the parents, to inform them at PTAs and whatnot of all of the implications of our actions.
Even at the
Yes.
clinics
Yes,
too,
at the clinics we do a lot of
when they come to.
yes
Yeah.
teaching.
Okay, go ahead, nurse.
Okay, so that's it for
Hospital.
Hospital Primary Health Care. Which other facility? Okay, we have Fosse Jacques, and the lead person at Fosse Jacques is Nurse Ellery Gaston. And on a Monday, they have diabetic and hypertensive clinic. Tuesday, she has antenatal and family planning. On a Wednesday, she has her medical clinic. Thursday, she has child health clinic. She also has family planning that day and cancer screening. On a Friday, she has the PBF persons from St. Jude's coming to provide the same service as Sufret to withdraw blood to assess the different conditions. Okay. In addition to that, she has psychiatric clinic the second Wednesday of every month. She has nutritional counseling on the first Wednesday as well. So it's interchanged with Sufre. Okay. So it's a smaller facility. We have dressings done daily as well. Okay, so wound management, that is a very important aspect where it's a walk-in clinic, so you don't need to make an appointment for that. What I forgot to mention as well is preparium visit, and that is for women who have delivered. It's the first to the 10th day of postpartum delivery. So it's after delivery and it's the first it's the first day to the 10th day. After the 10th day, we cannot assess you because there are certain things that we are looking for. So after the 10th day, it doesn't make any sense. So we encourage our mothers to come in with the child if they have the child at ease, if they're not kept at St. Jude's, or okay, you two come in with the child. Okay.
So that's the first 10 day after giving birth.
First day to the
Within
10th day. So you cannot come on the 11th day. So within that time, you have to
within
come.
that time, so you must come back.
We have Etangs Wellness Center and the lead person at Etangs. Oh, the health aide at Fossechak is Miss Rufina Nicholas and the attendant is Mrs. Mary Vitti. At Etangs, we have Miss Samantha Samuel. We have Mrs. Esther Louisi, who is the health aide, and Miss Delva Sidney, who is the attendant. On a Monday, we have diabetic and hypertensive clinic as well. Tuesday, we have medical clinic in the afternoon. Every first and third Tuesday of the month, the representatives from St. Jude's, they come to withdraw blood and do things of that nature, again, to assist our diabetic and hypertensive population and to confirm any cases. Wednesday, we have it's a big clinic at Etangs. So we have child health clinic, we have cancer screening, family planning, postnatal, antenatal, all of the clinics. We basically have them on that day. Okay. The second first day of the month, we have gynecology clinic at Eaton's Wellness Center. Friday is a home visit day. All of the facilities have home visit day, but this is where you have a team going out instead of just the one person. Yes, so maybe the nurse and the health aide, somebody is going out for sure.
And nurse also, they do home visits on a needs
Oh yes,
basis. So even if
definitely.
they
The
have
request. Mhm.
even if they have the Friday as home visit day, but if needs be that they have to go during the week or every other day, they will go every other day
And that
to
is for
out in the
every
community.
facility.
Yeah, in the community.
Yes. They'll say, oh, they also have psychiatric clinic on the the fourth Tuesday of the month, sorry. Okay. I might as well give the phone numbers now.
Yeah, sure.
Okay, so for you to get an appointment at ETANS, you can call 468-7766, 468-7768, 468-7770. For Fons and Jack, it's 468-7771, 468-772, 468-773. Sufra Hospital, 768-7610, 468-7616. Okay, that is to call to make your appointments.
But you don't need an appointment.
For the clinics, the specialized clinics like the dermatology.
Oh, okay.
Yes.
But
Or just
do you
inform
have
the list that you
some
can-
form of something
Like
like
a
a,
leaflet card?
yeah, like a leaflet brochure or something
Yes,
that
that
shows
is-
Somebody promised
like
to do it and I've not done it.
a calendar?
Like I have promised to do it and I've not hold
Well,
my
yeah,
end of the
we need to get
bargain.
that done.
My God, room
Yeah, so
on the radio,
so you need
you
a
have me.
you
What
need
not?
you need a calendar that shows all the clinics and what
That
it
is coming.
entails.
That is
Well, that
coming.
is
It's
coming.
it's in the process of yes,
Guilty
almost at
as
its final
charged.
stage.
Guilty as charged.
Okay, I mentioned Delse.
No,
Yeah.
you were just about to go to Delse.
Okay, so Delse, we have medical clinic on a Monday, every Monday. We also have psychiatric clinic the second Monday of the month. We have PBF personnel visiting to collect the bloods the first and third Monday of the month. A Tuesday is a home visit day. Wednesday is diabetic and hypertensive clinic. On a Thursday, we have child health. It's a comprehensive clinic as well. So we have child health, family planning, cancer screening, postnatal, antenatal, preparium, all of that. And on a Friday, it's a home visit day as well. Okay. So, like I said, we have dressings every day. At Magouge, on a Monday, we have, the number for
Delse.
they'll say 468-7756 and 468-7759.
And the two persons we have there is Nurse Charles.
We have Nurse Charles who is attached to they'll say Anne Magouge. And for the health aid, we have Miss Keisha Fontinel and the attendant is Miss Flora Dennis.
What's Nurse Charles' first name? Nurse.
Charlene Charles.
Okay, all right.
Okay, so Magouge, that Nurse Charles is the nurse in charge of Magouge as well. So on a Monday, we have diabetic and hypertensive clinic. On a Tuesday, we have medical clinic. So the second and fourth Tuesday of the month, this is when we get our visit from the lab from St. Jude's. And the third Tuesday of the month, this is when we have psychiatric clinic. Wednesday is a full day as well. So we have cancer screening, family planning, postnatal, antenatal, child health. Just like ETANS, this is they share that day. Thursday is a home visit day, Friday as well. Okay, so our last facility in the region is Lafag. Monday is diabetic and hypertensive clinic. On a Tuesday, we have child health clinic. On a Wednesday, we have a heavy clinic. So we have nutrition, we have family planning, cancer screening, postnatal, antenatal as well. The only difference is we have a separate day for child health clinic at Lafag. We also have every Wednesday at Lafag the PBF program. So the persons from the lab they come in.
But did you mention the time that it starts? Does it start at 9 or does it? What time does it start? The clinic? What time?
Okay, so clinic starts at 8.
At 8.
The health facility is open at 8 and it closes at 4:30.
Okay.
Yes.
So there are times like when you start off, at the time you start the triaging and so on. So sometimes when you come in at 8, that's the time they open the facility. So the health aides will take some time to settle in, and then they'll start calling you in to do the triaging or whatever else they need to do. And thereafter, you know, then you will see the nurse or the doctor or whoever else you have to. But don't expect a lot of people come at 8 and they expect to start at the 8 o'clock.
So
The
that
facility
might
actually opens at 8.
that might be the reason for the low turnout because persons don't like to wait. Persons are usually impatient, and you have persons who are at work who would love to use that service, but by the time they take a little break, it might be too late for them. It might be.
Let me tell you, the nurses are very accommodating. You're going to be at work, whatever. They could always set up a time with you. You may not necessarily. We're not telling you do not access the clinic on the clinic day. You may arrange something with the nurse so that she can fit you in somewhere that is going to be beneficial for everybody who's involved. So it may not be okay. Today's Monday. Today we're having this clinic, so you have to come. We are not so rigid. Okay, we'd like you to follow, but then if needs be, because we really need you to access these facilities because and these services, because early detection means early treatment. And if we can prevent you from going down that path where you have to spend more time out of work because you have to get treatment elsewhere, then we will.
Yeah,
Okay?
and it's less pressure on the health system if it's detected early that you don't have to.
That's too.
Yeah.
And another thing I need to add, and it's your approach towards the nurse too.
Okay.
When you come in, you know that's your day off, and like let's say you want to do your pap smear or you want to do breast examination, you have to arrange with the nurse in advance because you don't expect that when you come, just because you off on that day, so the nurse have to accommodate you. But if you arrange with the nurse in advance, the nurse can tell you yes, come at whatever time, or they can accommodate you, but don't expect because you off on that day to just come and say, well, you can accommodate me. No, because we always look at one aspect of the nurse job. By the time the person comes out, you feel the nurse doesn't have anything else to do, but the nurse have quite a bit of recording to do on the system and so on. And I too, I learned that whilst going to the wellness center. I'm saying, Deputy Amuna Sodwa no Sakora Kwebes Lot Moon. But the nurse has to record every single little observation, and that's what we fail to realize. So I always tell people when you come to the wellness center, you need to have patience. And there are wellness centers that I've been to, and let me tell you, people sit and no complaints. They know they're coming to the doctor's visit, and they sit and wait. I've seen that in Conridge, Fonge, Jacques Delce. But there are others, my God, the people actually live in the area, but yet still they live across the center, but yet still they want to live within the 5 minutes that they enter. And doesn't really work that way. And people need to understand these things. You come into the doctor, you're not the only one seeking medical attention. Come with water, come with something to eat if you have to. You reach that age where you have to go to the toilet very often. There's no reason why you cannot wear your pamper and come. These are the things people need to take into consideration. You have to, try to maneuver yourself because you're not the only one for the service. So, these are the things I really want people to take into consideration when they come to our wellness centers. Yeah. So let's go ahead. Sorry about that.
No problem. Thanks for the additional information. We were on Wednesday, so we're going to Thursday at Lafa. Good question, Alvin. On a first day, we have a medical clinic at Lafag that is a very heavy clinic,
Very heavy.
very heavy. And the first Thursday of the month, we have psychiatric clinic. Um, that leads us to Friday, which is basically a home dressing day. No,
Home
home
visit.
visit day. We also have two clinics that day. We have the internist who comes on the third Friday and the podiatrist who comes on the fourth Friday. Okay. I mention Magoshi's number?
No.
Okay, so Magoshi's number 468-7786 and 468-7789. Lafag's number 468-7791, 468-7793, 468-7794. Okay.
Yeah. Something I want to mention is that sometimes you might call on the lunch hour or you might call on the very busy clinic day. It's not that they don't want to answer the phone, but due to the nature of the job, sometimes it's not possible to answer the phone. Even if you call all three numbers, trust me, it has happened to me, and I'm saying, where are these people? But at the time, because imagine you have a baby and you weighing the baby, there's no way you could just go and pick up the phone.
Are you doing a
And
pap smear?
yeah, or you're doing a pap smear, there's no way the nurse can come out from there and go and pick up the phone. So you have to take that into consideration. And bell patients, you can always call back, or sometimes there are issues with the phone. And people, if you even if you don't get through and you have a vehicle, there's no reason why you cannot drive and come in person. Sometimes when you come in person, sometimes even the best thing to do than to just call. Yeah.
I would also like to add that at the facilities where we do not offer services like dermatology clinic, you can always speak to your nurse who is going to make an appointment, who will give you a referral and to make the appointment for you. Not because it's not available at your facility, that means you do not have access to it.
Yeah,
Okay.
that's true. Nurse. Another thing we need to mention is sometimes when you come to our wellness facilities, um, there are different requirements that you might need. Sometimes they ask you to wear your mask. Some people refuse to wear their mask, but it's part of the requirements for the service. So if they say mask, sometimes the mask are even provided for you, and so on. Again, one of the things I've been observing, if you come into a medical facility where everybody else is sick, I advise persons to cover up their body, especially our young ladies. And that's one of the things I've been observing. When you come to our facility and you have all your body exposed, you're putting yourself more at risk when you come to these facilities, and you dress appropriately, because one of the things, I mean, you are trained, you have trained professionals, but human nature sometimes, and you have to bear that in mind. I know I'm going to get a few backlashes for that one, but I can tell you, it really occurred to me that more and more it's getting worse, how people dress to seek medical attention. No longer people, dress appropriate when you come and seek medical attention, but I feel that's something that I need to mention. Um, Dress accordingly based on where you're going. I think it goes a long way. I'm not sure if Nurse want to add anything on that one.
Oh, just to add, it would be unfair not to mention the other staff at the facilities.
Oh yeah.
Yes, so for Magouche, we
Oh, you
have
get
we have Miss Macrina Diodoni, who is the health aide, and Mrs. Barbara Charles. They're both health aides at Magouche, and the attendant is Miss Shamina Francis. At Lafag, we have the nurse, who is the lead, Nurse Kadia Harrison. Most of you may know her as Joseph, Nurse Joseph. Um, the health aides, we have Miss Karen Bissett, Mrs. Silai Valse, and our attendant, Mrs. Petula Joseph. Okay. What I would like to add is for me to, I would like very much for me to see an uptick in our clinic, our numbers going up, and more persons, if anything, God forbid, that early detection, it's whatever is detected early, and you get the treatment that you need to get better. Okay.
Yeah, and also it's always wise to give feedback on the services that you
Oh
actually get
yes,
at our wellness centers and how well you can improve the service at our wellness centers. I know persons come with their own agenda. Some persons might not be happy with the service, some persons are happy, but sometimes, the feedback can go a long, long way as it relates to the services
oh
that are being
yes,
offered. I kind of, to tell you the truth, I've worked island wide, and for our region, I find the services are quite good. Some persons
it
might, like
really
I said,
is.
yeah, might not be happy, but as compared to other places, I really find that our medical team here really goes above and beyond to assist the patients when they come in. Oh, another thing I want to mention, sometimes we have our elderly persons coming to our healthcare facilities and asking other family members to come with them to provide them with that level of support, because sometimes it can be very difficult for them. I know sometimes they can be troublesome, trust me. By the time they say they're going and see their doctor, you just see them disappear and they go on their own. But some of them really need the support from family members, especially if they have to take the bus or if they have to wait for medication and this kind of stuff. So I'm really appealing to family members, if you have elderly persons that needs medical attention and they're coming to a wellness center, make some time to accompany them. Nurse, anything else you'd like to
I
add?
no no, just like to thank you for inviting me on the program. Thank you, Super FM, as well.
Yeah, I think you did a very good job, knowing that you didn't have one sheet of paper in front of
Yes,
you.
that's what I was thinking throughout, that she needs to tell me what she does for her memory, because there's
Yes.
no way I
Actually,
can remember so much.
I have one brain cell that is functioning. The thing is, I work at all the facilities, so I know. So I don't only go around in
No,
the
your
capacity of
memory
a
is very good, because I
supervisor,
cannot even
but
remember
I
her
actually
last
work at the
name.
facilities as well. Oh, Miss
Yeah.
Watson.
Yeah, and you remember the numbers, you remember the days, you remember the clinics, you remember, like, that was.
Yeah, and that's one of the things about nurse. She actually does the actual work at the facilities and so on. So that is one of the good things. I was wondering how she didn't have a paper to say, well, this is my
Yeah.
schedule and so on. But
I wrote. I was like, but you know, I,
yeah, but having said that, I would just like to thank you, Nurse, for coming on the program, and Romanus for assisting us this morning. I just want persons out there to understand that we're reaching out to you, and to ensure that you know exactly what is going on at our wellness centers and the services that are being offered. And it's for those persons who actually listen, it's for you to pass on that message to other family members and friends. We really would like more persons to utilize our wellness centers. I know some persons really like their own private doctors and so on. We don't have an issue with that. We welcome we welcome persons also going to their private physicians, but also persons that cannot afford. That is the ideal time for you to come to our wellness centers. And don't worry, things will remain private and confidential. We want to emphasize that too. confidentiality is one of the things we take pride in, and we hope that things continue remaining confidential among our patients and so on. So have no fear. We're reaching out to you to utilize the services, and we do not want, as Nurse said, when things get really bad, that persons come in and then they want you to create miracles for them. But whereas early detection could have prevented a lot of things like financial stress, emotional stress, and so on. Yeah. So again, thank you so very much, and do not forget to join in on our join our gold initiative. Wear your yellow, your gold tomorrow, as part of our childhood cancer awareness. We really want persons to be aware of all of these things. So again, I'm appealing to the public. Wear your yellow and gold. Okay.
Before you close, I forgot a really, really important service that we provide. For our antenatal patients, our pregnant patients, we offer free labs and ultrasounds during your pregnancy. Okay, so
Yeah.
free ultrasounds and all of your blood tests is being done for free.
Nice.
Yeah. Imagine I had to pay all that money.
Yes.
And that's part of the universal
For
healthcare
healthcare,
yes.
program. Okay. All right. 5 minutes after 11 in St. Lucia and the rest of the Eastern Caribbean. This is where we come to the end of Casualty 911. Thank you so much, Miss Wilson, and thank you so much, Mrs. Eloise. Mrs. Eloise, right?
Whoa.
I want to make sure I give that respect. So, Lamont time, Eloise. So, thank you guys so much. Keep it locked. This is where we come to the end.
Thank you.
Casualty 911, 10 a.m. to 11 a.m. with the consultant